Thanks everyone for being here with me today. I'm joined with two special guests, Dr. Hoff and almost Dr. Gilmour, who is going to talk with us today about their new paper that will be published in Transplantation. The paper is called Beyond Feasibility, Critical Steps Towards Drone-Based Organ Transport. So welcome. Rob, since you're the first author on this paper, can I get you to just kind of give an overview of who you are and why you got interested in this topic and working with Dr. Hoff?
Yeah, so I'm Rob. I'm a final year medical student at Edinburgh University in Scotland. And I've sort of had a real interest in transplant surgery throughout medical school. And I started talking to Mekhola, who's been my sort of research mentor over the past year or so. And she's a consultant or attending, as you might call it in the US, a transplant surgeon here in Edinburgh as well. And we were sort of talking, and she mentioned her interest in drones and how they could potentially be used in organ transport. So I thought that sounded fascinating. So sort of had a look into the literature, and it all kind of started from there.
Fantastic. And so what are your findings? What's the current state of the use of drones in transplantation, or for organ transport, if you will?
Yeah, so I mean, so far there's been a few really high profile sort of proof of concept flights. There was one in Baltimore where they managed to transplant a kidney after transporting it by drone. And there was one in Toronto as well where they transplanted some lungs. So they're the sort of main two that sort of showed that drones can sort of work. But they were very highly controlled. So we sort of know they can work, and we're sort of now trying to figure out the next steps of how we can actually incorporate them and what's next.
Yeah, that's really interesting. So your paper says that in many countries they already deliver blood, vaccines, and lab samples to remote areas, which really can help overcome geographic and infrastructure challenges. So can you talk to me about that a little bit?
Yeah, so I think it started in Africa. It's a huge thing in Africa right now, especially in Rwanda. There's one company called Zipline who've sort of been delivering blood samples across Rwanda to different locations for the past few years. I think they've kind of scaled it up all over Africa now, and it's sort of found to be really successful as the roads might not be the best in those areas, or the cars might not be as good. And they found that drones, because they sort of deliver a direct path, actually sped up the time, um, and yeah, saved them a lot of money, I guess.
Wow. So do you see this as the future? Is it a bridge to something else?
Yeah, I mean, I think like there's loads of different things. I don't think they're like the be all end all sort of solution. I think there's sort of several innovations coming together that need to make the whole system faster. I mean, me and Mekhola have kind of proposed sort of a drone hop system. Because all of the sort of research on drones now have been for sort of short distances. So we were sort of looking, and we noticed, especially in, well, for Edinburgh especially, but I think this will be similar for everywhere around the world, in sort of bigger cities, a lot of the delays happen from sort of hospital to airport when the organs are getting transported. I mean, Mekhola can speak from it from experience, but like if you're stuck in busy traffic, for example, sometimes a 20-minute journey can become close to 2 hours. Whereas if that's by drone, you're always going to have the same journey. It's just going to be direct. You're not going to have any issues with traffic or anything like that. So it can save a lot of time, which is obviously critical for the organ.
So you talk about these, cases. I was fortunate enough to be living in Baltimore at the time when our colleagues across the way at the University of Maryland and my dear friend Joe Scalia were working on some of this. And I remember it making, national cable news and kind of made a big deal. Can you tell me about what that was like to see it happen in the United States? What kind of inspiration did that draw for everyone around the world?
I only found out about it in the past year from Mekhola, actually, who was it that told me all about this. But yeah, I remember actually being shocked. Like the concept of a drone carrying something like an organ to me was absolutely insane. I mean, it sounded actually insane, first of all. But then when we looked more into it, we just thought it was amazing. And the fact that they managed to pull this off, was just really inspiring. And I guess like all these sort of examples, like the one in Baltimore and like the one in Toronto, and even all like the stuff in Rwanda and stuff like that, I think that's what sort of inspired us to really get into it because we're like, well, if they can do it, then why can't we hopefully bring that over to the UK at some point? Yeah.
Yeah, so one thing I read in your paper is that you think that one of the most immediately scalable opportunities kind of lies in transporting time-sensitive blood and tissue samples, such as wet cross-match material that we do for HLA typing, or even post-transplant biopsies. What needs to happen for us to be able to test that as a proof of concept?
Yeah, so we'll obviously need more pilot trials. It'll be pretty similar with the organ transport, but I do think it'll be a lot easier in terms of I don't think we'll have as many regulations from, for example, us in the UK, we're limited by NHS Blood and Transplant. They're the people that sort of control all that. So I
Mhm.
think it'll be a lot easier to sort of gain approval with blood samples and stuff like this for cross match and HLA typing. So I think that will be a lot easier overall, and the regulation should actually be less, but we will be faced with some of the exact same issues that organ transportation will have, like beyond visual line of sight restrictions, even stuff like liability and stuff, will sort of be still issues that we have to face.
And so you think that we need to do comparative trials. Can you tell me a little bit about what comparative trials might do? I think I read that you think that it would evaluate like the timing and temperature control, other things, maybe mechanical stressors. But then ultimately, like what will we need to look at in the transplant patients to understand whether or not the outcomes are the same for an organ that was flown and then transplanted flown by drone and then transplanted,
Yeah.
or just transported in a more traditional way.
Yeah, I mean, I think the main sort of thing in the pilot trial that we'd like to do is sort of simulate how this would look in sort of a real transplant workflow. So, like, if we suggested doing from Edinburgh Airport, sorry, the Royal Infirmary of Edinburgh to like Edinburgh Airport to another airport and seeing if this number one is feasible. And then number two, like you said, tracking things like temperature, vibration, seeing if these have sort of an effect. And yeah, getting probably, I mean, transplanting them to a patient would be ideal, but I think before we do that, we'd sort of be using dummy kidneys and taking biopsy from these and looking for any sort of signs of damage or stress.
Wow, that sounds exciting. And I'm gonna think to the future, but also not the so far away future, right? When we might have a world where there are non-human kidneys, so pig kidneys available for transplant around the world. This might be a probable solution for logistical challenges that will be faced with organ transport. Dr. Hoff, what do you think about that?
Personally, I'm really interested in technology and how we can apply it to transplant and make things better. And so I'm always keeping an eye out for interesting technologies. And we know that drones are an emerging disruptive technology that has the potential to transform healthcare delivery in general, but as well as transplant. Um, I think what we set out to do is to find out what had already been reported in the literature, and the fact that we're big fans of the Sage and Scalea reports, and we feel that we should be able to translate it going forward. And I think as the transplant community, we should acknowledge this new technology, and it's our responsibility to explore this as an option for our patients to make things better. And I don't think it's such a fanciful idea anymore. I mean, the military have been using it with frightening precision. Amazon is starting to deliver goods in localized places within the UK. I mean, good for goodness sake, we need to start looking at this in transplant. And I think for clinicians and transplant stakeholders to buy into this, we need to provide them with evidence that this is a safe thing to do, a feasible thing to do, and a cost-effective thing to do. And one of the things that's probably holding us back, is that it's finding those key markers that we can benchmark ourselves against. So, for example, the cold ischemia time, what does drone travel do to injury to the organ, if at all? And do we really know what happens in the normal delivery pathway? For example, with the national allocation system in the UK, we frequently have organs flying all over the country. So, they'll have a road journey to the airport, then will be handled in security, possibly handled by, non-medical personnel, put on a plane, travel to the other side of the country, then again, another road journey. And this is happening all the time. And we don't really know if, there's any impact there, especially on more fragile organs like, say, the pancreas or the liver.
Wow. Yeah, no, I agree with you. This technology needs to be investigated. It's always wonderful when technology almost outpaces us in science with our, kind of the time it takes to write these things up. But it's super important that everyone that's innovating does take the time to put this in the literature so that we can move forward from it with a great evidence base. I would like you to talk with me a little bit about the legal and regulatory gaps that you've identified. Can you tell me a little bit about what those challenges might be and how we might face them in the future?
Yeah, so I guess, yeah, one of the main issues, regulation. You've got the beyond visual line of sight, so or BVLOS as we call it. So this is like one of the hardest things to get as approval from in the UK. I think it's the FAA, the Federal Aviation Authority. So it's getting approval from them so that these drones can fly BVLOS, I think is the hardest thing that we need to sort of address right now. And then the other thing, I guess, is integration. Like, how are we actually going to integrate them into our transplant networks? I mean, in the UK, it's NHS Blood and Transplant and the Human Tissue Authority that covers it. But I know in the US, it's completely different. You've got like loads of OPOs and UNOS is doing something. So it's more about, yeah, how can we figure out where exactly they go? And I guess from a legal standpoint, there's a huge thing about liability. So if in the rare situation that a drone does sort of crash or something goes wrong, who's responsible? Is it going to be like the drone operator? Is it the hospital? Yeah, who's it on? So we sort of proposed a sort of shared liability framework. So everyone sort of shares a responsibility rather than being on one person.
How is the buy-in for that shared responsibility framework, or is that something that your authorities have suggested is a palpable thing to do?
So we've not actually spoken to any of them right now, but what we're doing next is we're actually doing a sort of clinician phasing survey and doing sending them and asking them if they think that's reasonable or if they would vouch for it and all this stuff. So hopefully we're going to send that back and get the responses soon.
Perfect. So
Yeah.
you're go ahead.
Oh, yeah, I'll interrupt. So we have the Human Tissue Authority, and there's slightly different regulations between England and Scotland. And I think going forward, as Robson's suggested, it will take a lot of discussion between NHS Blood and Transplant, the British Transplant Society, and the relevant stakeholders. There, I think we did get in touch with them, and they said. Gave us some general indication about transport of organs being under sort of responsibility of IMT, who is our sole transport provider within the UK. So I think for different countries, it's going to take different discussions according to the different regulations. But yes, it's ongoing.
It seems to me like you are in a space where it might be a good location to test these proofs of concept because the regulatory scheme compared to the United States sounds a bit less complicated, if you will. And so that's so exciting. I really am excited for your research, and I hope that you'll be able to continue to bring the provider perspective. What about the patients? Do you think that work needs to be done to see if this is an acceptable way, or is it kind of like patients are ready for us to innovate? Why wouldn't they want us to do this work?
So I think the UKR Research Institute, they did do a survey a couple of years ago, and there was broad public approval for drone assisted healthcare delivery. I'm not sure that it was specific to transplant, but in general. So there was support, but there were concerns voiced about safety, patient confidentiality. And those are things I feel will need to be addressed going forward. Yeah.
Cool. I see in your paper you talk about needing to identify the right use cases, right? You say drones are not intended to replace existing transport systems, but to complement them, especially in cases where traditional methods are costly, delayed, or logistically inefficient. What would be an example of a use case you would want to design for study?
Oh, I can help you with that one. So it's quite interesting how logistics sort of differ between different parts of the country. So I did my transplant surgical training in Cambridge, which is in the south of England. It's a very flat area. It's well connected by lots of, nice big roads, an hour's drive away from London. Or, back then I could just wait for an organ to arrive and, I could just concentrate with operating. Since I moved to Edinburgh, and I don't know if that's part of me, changing from being a trainee to a consultant, or the geographical location, but suddenly a lot of my on-calls was spent in the middle of the night negotiating how to get an organ from another part of the country to my hospital. So, for example, if I had be a retrieval overnight and a potential pancreas and kidney arriving to my hospital, I would then have to make a decision about whether we charter a flight for a cost of £10,000 to £20,000 to get it over to us within the appropriate cold ischemia time. Or, if the retrieval's delayed, can we wait until the morning so that it can make a scheduled flight? So I envisage seeing drones helping out with these last mile and first mile deliveries so that organs can make scheduled flights rather than expensive commercial flights, to then thereby saving the transplant community money. It's crazy how much we spend on these jets. So that's one use case, I would say. Other use cases could be, especially for organs like the heart, where ischemia time is critical, to shorten the journey there. We would be in touch with cardiothoracic surgeons and try and see how we can facilitate that, because I know they struggle a lot.
Wow. Makes a lot of sense to me. It really does. If you can cut off the expensive parts and allow an organ to travel in a more cost-effective way, you're kind of saving everybody time, energy, and money with the technology. I love it.
Yeah. And then the other part I had, use case scenario, I'm drawing a blank. I don't know. I wanted to tell you something and now it's gone out of my mind. So perhaps I'll get back to it.
No, it's okay. Yeah. I'm seeing in your paper you talk about the final leg transfers relying on the ambulances, which are like costly and traffic prone. And I totally can see this.
Yeah.
It makes sense when you put it like that. Why can't you use it as an integrated part of a system? It's not going to necessarily replace one mode of transportation, but it's going to augment the existing flows that exist. And I love it.
Oh, yes. And that was the other, so you've reminded me now. So that was the other thing. At NHS Blood and Transplant, we keep key statistics about how, performance indicators, so are the cold ischemia time of all our kidneys, pancreases, livers. And we're good at that. But what the data doesn't show is the number of organs that we're not able to accept for our patients on the transplant waiting list because of anticipated problems, anticipated prolonged cold ischemia times. So what that means is it disadvantages our population because we can't tolerate that organ spending so long traveling across the country. And especially in an age when we're using more and more marginal donors, our donors are becoming older, more extended criteria, they're going to be less, they're going to be more vulnerable to cold ischemia. And yeah, I think our patients are missing out actually.
That is also a very interesting way to look at it. I have a question this raises for me about machine perfusion. So how does machine perfusion work with the drone? Is that going to be possible, or is this something that are not going to be exclusive?
I mean, theoretically, it could be possible. I think right now, civilian sort of drones or drones used in medical use probably aren't ready for that. But if you look at a lot of the drones that are used in the military right now, they can handle capacities of over 100 kilograms. And when speaking to some of the machine perfusing companies, a lot of their stuff weighs between like 20 and 50 kilograms, or there's none really over 100. So realistically in the future, if we could somehow access some of those drones used in the military, it could potentially be a combination of those technologies. You could have an organ in perfusion also getting transported by a drone then onto a plane, which would honestly extend the cold ischemia time massively.
Wow. Well, I, for one, am excited for the work that I see you both working on now. But importantly, I think the work you're setting up for the future and the conversations that you're having with the right people to make sure that these types of innovations in transportation can actually be used. I think sometimes we always kind of struggle with the let's do the science and we're going to figure it out. And then what's the next step? How are we going to actually implement that? And so I love that you are thinking about those things now and engaging the community and engaging the legal and regulatory authorities in this conversation. So I wanted to thank you both for joining me today on our transplantation podcast about your paper, all about drones. And do you have anything else you want to leave our viewers with? It's okay.
I guess just yeah, it's not about replacing anything currently. It's not about replacing the planes or the ambulances or anything. This is more about fixing the weak links where the current systems are failing and how we can complement them.
That's a good point. Anything else, Dr. Hoff?
No, I mean, I think I made my point previously, and I'm just really pleased to. I was really pleased and to hear that you guys were interested in our paper. It was Rob did all the hard work. We spent a lot of time revising the manuscript, and we're really pleased. We're getting the message across.
Thank you so much for your work, and we appreciate your time. I hope you have a wonderful rest of your afternoon.
Thank you very much for having us. Thank you.
Thanks.
Thanks
Take
so
care.
much.